Hey, Dr. C with you. Do you need thyroid medication? If you were told to take it, should you? If you're on it already, should you be on it? Should you stay on it? Are you better off not taking it? These are big questions, and they're answers that might surprise most people. We now have a huge mismatch between what we know about what thyroid medications can and can't help and how often they're given. And this is true both in the conventional world and the natural world. It's been estimated that thyroid medications are among the top 2 or 3 prescribed medications globally, and that 90% or more of people may not be good candidates for them. This is important because if you don't need the medicine, not only may it not help, but it may cause risks, it may cause side effects, and it may cause long-term harm. I'm really passionate about getting this message out there. Surprisingly, in many cases, unnecessary medication feels a lot like being hypothyroid. So a lot of folks who really do have hypothyroid symptoms and may have some early abnormal thyroid blood levels are put on medication. And even when it does help the blood levels, it may not help the symptoms. It may change them, it may make some worse, but people are often left struggling. And for so long, it was thought that the answer was different medicine or more medicine or something else with it. And now we know that thyroid disease is not really just a lack of thyroid hormone. Let's talk about that briefly. So it can be. So thyroid disease can be too little hormone. It can be also the whole autoimmune process. And of course, too much, but that's separate. We now know that for most people, the symptoms are caused by autoimmunity. They're not caused by a lack of hormone. We've looked at the TSH, these various T3 and T4 levels, the thyroid antibodies. When thyroid antibodies are present, especially when they're high, they cause problems. Medications don't help with these problems. And most people that have abnormal thyroid function have autoimmunity. Surprisingly, even those that don't have measurable or positive antibodies. So what's happened is that we've put a lot of weight in the TSH or even the T3 and T4. And they're important at the extremes, they're totally meaningful. But at earlier stages of disease, they don't show a lack of hormone. At late stage of hypothyroidism, what happens is the TSH gets really high, like over 20, and the T4 goes way below range, so does the T3. In those cases, you might be surprised to know that medication is not the only option, that many people still respond to the thyroid reset diet, but medication is a reasonable option, and it's got a much better chance of helping. But most people that are put on medication aren't that far along. Either they don't have severe hypothyroidism like I described, but they do have autoimmunity, or they have a milder version of hypothyroidism. In the first mild form, their levels are normal, but someone could argue they're not optimal. There's valid arguments for that, and that can mean that you're getting symptoms. It can be a cause of symptoms, but it doesn't always follow that a problem causing symptoms is resolved by medication, because it's not always a simple lack of thyroid hormone. So even if your thyroid's low, putting it back to normal with medication may not help. So what I just talked about there was called suboptimal, so normal but not ideal. The next step is called subclinical. It's not even normal anymore. The TSH is above range. Even in these cases, before it gets to be severe hypothyroidism, medications almost never help. In fact, a really large study looked at millions of people over several years, and it showed that medications for treating subclinical disease don't lower symptoms, don't improve quality of life scores, don't help weight loss, don't lower long-term disease risks. They don't even cut the risk of thyroid disease getting worse. They don't make a difference in these ways. We do know, however, that thyroid medications do raise the risk of many cancers, raise the risk of mortality, and other problems. So this is really big. And that's the problem, is that someone is in a situation in which there is something wrong with their thyroid. They are not feeling well. It's a real thing. But it doesn't always follow that medications help. The thyroid from outside your body doesn't work the same as it does from inside the body. So that's one big disconnect we've learned about. The other big new finding is that the thyroid's more resilient than we ever thought. We've had several big studies showing that with simple dietary intervention, that autoimmunity, mild, moderate, even in some cases severe hypothyroidism can reverse for most people in a short period of time. So if you're not on medication and you've been told to take medication, ask why. If the medication is for Hashimoto's, for thyroid antibodies, same thing. Or if it's for normal but not optimal thyroid levels, the medication was not likely to help. Now, same thing, let's say you have subclinical disease, your TSH is high, but your T4 hasn't dropped. Medication is not likely to help in those cases. Now, I'm not saying that no one has never taken a medication and felt better, but what we know is that when medication is the only variable, it doesn't typically help. Most of my peers in natural medicine, I should say none of them just give medication. They also give dietary advice, they'll recommend helpful nutraceuticals. And if people get better, we can't assume in those cases it was the medication. So we have to rely upon the data we get from big studies in which medication is the only variable. And when it's the only variable, it doesn't do much. So what we now know is that in those other cases where someone did a bunch of stuff and it all seemed to help, the medication wasn't a big player in that. The natural treatments were more powerful than people thought. The medications had less of an effect. If you're told to take them because your thyroid's a little low, or to prevent it from getting worse, or because you've got Hashimoto's, or because it's suboptimal, these are not things it would likely help with. There's more risk and harm than there is benefit. Now, what do you do if you're already on medication? You know, the thoughts are really to see if you can take less. And for some, that means lowering the dose, always with doctor's guidance. For some, that means doing so in a stepwise fashion and ultimately not requiring any at all. This process is called deprescribing. I've got some very detailed blogs and videos that outline this, but that's an appropriate step. I've had scores of people under my personal guidance or who have written in that have worked with their doctor using my work, and they've done that. They've come off completely, they feel better, or they've lowered the dose by a lot. And again, the problem isn't in almost all cases that there's too little hormone. The problem is that there's autoimmunity or poor usage of the hormone. And in many cases, adding medication makes all that stuff worse. So super important topic. Please check this out. Please take it to heart. Please share it with loved ones because you can do better and you can have better longevity and better safety.